Uganda is an East African country, also known as the Pearl of Africa. On the 19th of September 2022, it was hit again by the dreaded Ebola Sudan strain amidst the COVID-19 pandemic in Mbale district, 150 kilometers west of the capital city, Kampala.
I wish everybody seriousness in dealing with Ebola. I now direct as follows. Number one, movements into and out of Mbale and the Kasanda districts is prohibited.
Here in Mbale, east of the country, the land of the Bamasaba people, we did a qualitative study on the community's perceptions regarding preparedness, response and prevention of the killer virus Ebola amidst the COVID-19 pandemic. In partnership with Busitema University, Mbale Regional Referral Hospital, Mbale College of Health Science, the Emergency Care Society of Uganda, and Seed Global Health.
We got different views from different categories of people, from border riders to market vendors to people who are in their local bars enjoying their local drinks.
Mzee President yagamba ngo mutafunye obulwadde bwa Ebola oyambala gloves nomala oteekako mask n'omutwala wa mudwaliro nga basawo nga tebaliiwo sobola kumwetwalira.
Despite a lot of government efforts, the response to Ebola was contingent.
Majority informed us that Ebola is something that they can handle themselves.
Sobola kumukwatako naye nentuuka mu ddwaliro ne bampako jiiki ne mbagambe mukwateko namukwaseeko ne bampako jiiki.
Enforce hand washing, sanitizing using alcohol, hand rub in both districts. These are in the offices, but in the homes, I think people can use soap.
Amidst an emergency, sometimes when resources are not available, you're meant to improvise. And that's the border rider who is informing us that for him, he would rather handle his wife, clean him up with all the blood off, and then prefer to take him to the facility even without PPE because they don't have them at home.
Munaza ne mwambaza ne muteka ku border ne mutwala mu ddwaliro omusawo n'amukolako.
Our findings show a mismatch between information circulated by the president during national addresses and how the locals interpreted it.
This one I had told you last time, when somebody gets sick, don't call border. Stay at home, you call the health workers.
We also noted a knowledge gap. There were misconceptions regarding the Ebola virus disease.
It was hard for them to believe that Ebola is a disease because most of them thought it was witchcraft attributed to the people of Kasanda and Mbale, and they felt that Ebola would not come to Mbale. Some really thought that they could give first aid in the process process of trying to give some small antibiotics and analgesics or Panadol, and then wait for maybe the next day, depending on what time they've identified the case.
Sobola kugenda ku kiriniki nefuna furagiri nemuwako enkya nemutwala mu ddwaliro.
Regarding antibiotics use amidst Ebola outbreaks and other public health emergencies, really it was alarming because most of these people have the antibiotics at home, just like one of the market vendors said. They can give fragile, but really seek health care after giving this first aid.
We call upon all stakeholders to invest heavily in community engagement strategies that transform community perceptions to promote infection control and patient safety.
The details of this can be found in our publication, which will be published after this conference.